Freedom is just another word for the Medicare for the Lazy Man podcast. The Medicare podcast that keeps it country. And now, brace for a hard landing, it's Medicare expert Doug Jones.
Hello, everybody. Welcome to Medicare for the Lazy Man podcast. It's your old buddy, Uncle Doug here, as my Canadian nephew, Drew McMillan, may have told you. I am here to help you feel confident about your incredibly frightening encounter with Medicare that may be coming up soon. Now, it may not be coming up soon. You may be here just for the entertainment value, in which case I should tell you, get a hobby. But if you've got a Medicare encounter coming up soon, you've come to the right place. I encourage people to prepare for that encounter by asking them to buy my book, Medicare for the Lazy Man 2024 is the current edition that's out. And what people often do is they go to barnesandnoble.com or amazon.com, and they put the book title in the search, Medicare for the Lazy Man 2024. And depending on where they are, they can select the version of the book that they want to purchase. And often that version turns out to be the paperback, which will have illustrations in it and will be shipped to you from the warehouse that is currently being used for that company's supply of stock that they send out. And when that book arrives, I often suggest the buyer of the book pour himself a stiff drink, sit down in an easy, comfortable chair, and begin the reading. And within an hour and a half, the reading part should be over. The knowledge will be seeping into the human brain, and one will feel so much more confident about the Medicare encounter that is coming up that it's going to be a happy experience. Now, within the books, once the knowledge has been absorbed, is also my contact information. And after reading the book, Medicare for the Lazy Man 2024, you have questions about Medicare, or if you're looking for an agent to help you cross the path from wherever you are now into Medicare land, then you contact me using the email address that you're going to find in the book, and I will help you with all of that, because that's what I like to do, is to help people join the and sisterin in the land of Medicare. And I, following my recommendations, is going to lead you to a land of bliss and happiness that you never thought could exist in the Medicare world. So Medicare for the Lazy 2024, that's your target for today. And my target for today is to figure out some way to entertain Randy Carson, because the last time I tried to do that, the internet connection broke down, and he wondered whether I did it on purpose or not. But Randy, are we connected now?
We are. I began to wonder there for a moment. I went out to get my coffee and Doug says, "Yeah, I'll be right here." I come back, no Doug.
Yeah, and I had no Randy. It was a frightening experience. I thought, well, I guess that's the end of our empire, our Medicare empire.
The Medicare for the Lazy Man empire has just bit the big one electronically.
Yeah, and frankly, then that would be the last time I would hear anything about the quarter machine that dictates the length of our episodes. But in any event, what we've got is a project that we do every episode that hopefully impresses people that are joining Medicare, that they should be careful, that this is not a decision to be taken lightly. And my recommendation for those people is do not enroll yourself in a Medicare Advantage plan. Stick with Medicare Supplement along with regular old-fashioned original Medicare. Medicare Advantage can be a disservice, and it can be a very disappointing experience. Randy always helps me out with that by choosing the major stack of articles that we've collected about Medicare Advantage. And so it's time for Randy to select the article number that he wants us to deal with today.
Well, as you know, every night I spend quite a bit of time thinking about this.
That's what I've heard. That's what I've heard.
So
your children and your grandchildren wish you would spend less time doing that, I'm sure, but
This is based on a lot of serious consideration, but
Mm-hmm.
I'm going to go with number 11,
Oh
prior
boy.
authorization reform.
Yeah, that's a
And,
big subject.
based on one of my favorite expressions is as related to
Delay,
prior author
tr
delay. Go ahead.
deny, and dead. Is that
Well, you're
right?
close. You're
Tell
close.
me, what's the real?
Died after denial is one.
Yeah. Yep.
There's died before approval. And
Mm-hmm.
then there's one more called delay, deny, decapitate, dead.
Okay, I missed the decapitate part, but Randy spends some time with the acronym machine, pushing the button and seeing what the acronym machine comes up with, and he's been right on the money more often than not. And this article, number 11 that he chose, prior authorization reform is once again picking up steam in the halls of Congress. One of the big complaints about Advantage plans is that doctors have to deal with paperwork and get permission to treat the patients instead of relying on their medical expertise to do that treatment themselves. So Medicare, the American Medical Association, and a bipartisan group of congressional leaders to stop unfair prior authorization practices from Medicare Advantage plans. And it's introduced by a bunch of Democrats. There's a representative from Washington. There is, let's see, 100. Oh, but it's sponsored by 130 members. This piece of legislation that she has introduced, and 42 senators. So not quite a majority yet. She says we made important headway in helping older people get the Medicare care, the medical care that they deserve with the administration's prior authorization regulations. She says that in a statement. However, we must go further and enshrine these advancements into law. She said that prior authorization burdens physicians and patients with long delays and unfair denials. The legislation, which unanimously passed the House in September of 2022, would standardize the prior authorization process for Medicare Advantage plans, mandate improved transparency, and codify deadlines on prior authorization decisions. The new legislation obtained approval from the AMA and other industry groups. So they are behind it as well. Modernizing prior authorization for Medicare Advantage patients is vital to reducing the costs, which are the legacy of an antiquated process of requiring faxes and phone calls in time-sensitive clinical situations. That was a statement by a senior vice president of governmental affairs for some company. Company's name is Premier. I don't know what the heck they are. So I should have done a little more research before reading this article. The average physician spends 2 business days completing this paperwork. In how long a period of time? The impacts on patient care are jarring, with nearly 97% of physicians reporting that their patients experience delays or denials for medically necessary care due to prior authorization requirements. We think this is the year to get this bill over the finish line, says the president of AMA. Insurers, however, say prior authorization policies are important tools in reducing costs and in ensuring that care is both medically necessary and safe. But the insurance companies plan increasingly face the insurance plans increasingly face backlashes for restrictive requirements. Some payers support the proposal, including Humana. We are encouraged that the bill promotes expediting approvals of care through greater adoption of electronic prior authorization, which has been demonstrated to improve health outcomes and reduce costs for patients. During AMA's annual meeting, representatives agreed that health insurers should be legally accountable when prior authorization policies conflict with the best interests of the patient. Waiting on a health plan to authorize necessary medical treatment is too often a hazard to patient health. To protect patient-centered care, the AMA will work to support legal consequences for insurers and patients by imposing obstacles and burdens that interfere with medically necessary care. The AMA also wants to see better justification as to why claims are denied from insurers in the form of a denial letter that includes reasoning, rules or policies cited, what it would take to approve treatment, and possible alternative treatments. real-time prescription benefit tools, which streamline decisions or offer treatments that do not need prior authorization by letting physicians access drug coverage information in electronic records, is another priority for the organization. Other resolutions at the annual meeting called for Medicare supplement annual open enrollment periods and expanded hearing and vision coverage for Medicaid members. Well, I'm not sure I'm all in favor of expanding Medicaid more than it is right now, but there's something to be said for Medicare supplement open enrollment periods. Many states are already doing that, and that leads into an article that I had put aside a while back, but maybe this is the time to address it. Open enrollment periods for Medicare supplement plans do exist in many states, and they're called birthday rules. The birthday rules typically allow a Medicare supplement insured or the owner of a Medicare supplement plan to change the plan from the one they're in to a different one unless they are and normally they would be able to do that by showing evidence of good health. But let's say they're not in good health, or let's say that they're lazy and they don't want to show that evidence, or they don't want to do that paperwork. If they live in a state with a birthday rule, then they're going to be able to make some changes in their coverage without having to show evidence of good health. And that would include states like California, which has had a birthday rule for a long time, but has recently been liberalized. Idaho has a birthday rule. Maryland, I think, has just instituted a birthday rule. Illinois has one that's less than a year old, I think. Kentucky has a birthday rule. Louisiana, Nevada, Oregon, Missouri, Massachusetts, Maine, Connecticut. In New York, you get new coverage anytime you want to. You don't have to wait for a birthday rule. As long as you have a Medicare supplement plan, you can, and you've had it for, I think, 3 months or something like that, you can switch to a different Medicare supplement plan anytime you feel like it. Vermont and Washington also have some form of birthday rule. So the whole thing is, it may be time to consider about allowing people to switch to Medicare Advantage or Medicare supplement plans other than the one they have, with a guaranteed issue basis. The one thing that about is it will drive up the cost. So Medicare supplement plans already have a monthly premium cost. And if you ask the insurance companies to allow their lesser quality insureds, their unhealthy insureds, to go to richer coverage, then there's going to be a cost to that everybody is going to have to bear. But it's something to saying an idea that should be rejected out of hand. So anyway, at this point in the episode, I like to consider our Medicare page from Wikipedia. It is a massive, massive entrypedia list of pages, and it is chock full of Medicare minutia. And so right now we're at parts A and B, late enrollment penalties. So if an individual, now this is for part A, the late enrollment penalty for part A, which is hospital insurance under Medicare. If an individual is not eligible for premium-free part A, meaning they haven't worked at taxable employment for a minimum of 40 quarters or 10 years, and if they do not buy a premium-based part A when they are first eligible, the monthly premium may go up 10%. The individual must pay a higher premium for twice the number of years that they could have had Part A but did not sign up. Oh, good. Everybody should remember that, huh? For example, if they were eligible for Part A for 2 years but did not sign up, they must pay the higher premium for 4 years. Usually, individuals do not have to pay a penalty if they meet certain conditions that allow them to have to sign up for Part A during a special enrollment period. Now, the Part B is in Bravo, late enrollment penalty. If an individual does not sign up for Part B when they are first eligible, they may have to pay a late enrollment penalty for as long as they have, which is, I'm guessing, is going to be the rest of their lives. Their monthly premium for Part B may go up 10% for each full 12-month period that they could have had Part B but did not sign up for it. Usually, They do not pay a late enrollment penalty if they meet certain conditions that allow them to sign up for Part B during a special enrollment period. So I think that'll do it for today. Next time, we're going to go with comparison with private insurance. I like that. It is comparing Medicare with private insurance, I think, is what it's all about. So that's going to be pretty exciting. I uncovered a new trend among the government wannabes, the government types, the bureaucrats that like to run every minute detail of our current lives, have gotten a new method of making life miserable for other people and trying to get the government to pay the freight. So we're going to deal with that in just a couple of minutes. But first, let's go to a Medicare. It's not a Medicare minute. What are we going to call this? A break for commercials having nothing to do with Medicare. Let's take that break right now. Okay, I'm hoping that it was pretty entertaining. If those commercials were not to your liking, then don't tell me. Let's tell the people that actually are in control of placing them into the podcast episode. So I was talking about how the government people are jumping up and down about a new trend. They found something new that they could sink their teeth into and try to make everybody pay extra for problems that only and the disadvantaged have, they say. This is a new trend that they're starting to pound on and beat the drum, and I'm frankly disappointed they haven't come up with something better than this. The headline on one of these articles is over 2,300 people died from heat last year, mostly in the desert Southwest. Now, I don't know why people would go to the desert Southwest and not and then be surprised that it gets really, really hot. And in any given population in the desert Southwest, a certain number of people are going to die anyway. But what this article is trying to do is draw a line between living in the desert Southwest and dying of heat stroke or something like that. And Randy's going, come on, let's, he's been in the desert Southwest for 24 years. And this is not new to him, but apparently the author of this article is surprised by the whole thing. The lead author of this report, which was published in the Journal of the American Medical Association, told USA Today, well, that may be where the flaw in the reasoning goes, the deaths were overwhelmingly concentrated. Now, hang on to your seat, Randy, fasten your seat belts. The deaths from heat were overwhelmingly concentrated in Arizona, California, Nevada, and Texas. The death toll is likely an undercount. Is there some people that just...
I am just shocked. I'm shocked.
I know. I hope you didn't fall out of your chair with this shocking news. Heat deaths in the U.S. reached record level in 2023, a study finds. More Americans died from heat in 2023 than in any year over the 2 decades of records, according to the findings published Monday. Last year was also the globe's hottest year on record. Oh, they love to say that, too. The latest grim milestone in a warming trend fueled by climate change. Oh, the only thing they haven't done in this little article is blame human beings and gasoline-powered automobiles for this climate change that they say is occurring. I think one of the things that happened to cause the global warming was that the Russians back in 1989 ran out of money to pay for the weather stations that they had lining the Arctic Circle, and so they stopped reporting the extremely cold temperatures from their far northern reaches. And, of course, the arithmetic average of all thermometer readings all around the world went up just by virtue of the fact that Russians were not measuring their thermometer readings in the cold Arctic atmosphere anymore. So here's another article. This headline is really a heart grabber. Extreme heat is causing my patients to suffer and die. Trump Republicans don't care. Now, this is written by some doctor, opinion contributor. So he's got an opinion. A young, healthy man collapsed in a field, unable to wake up. He ended up in my hospital's emergency room with a temperature of 105 degrees. He did not have a rare infection or hidden cancer, but something more insidious, a condition affecting all of us, the scorching heat. The agricultural worker had a deadly case of heat stroke. The earth has again reached a milestone of hottest days on record. Whether or not we believe it, global warming is real, and the effects on human health are significant and lethal. We must keep the climate crisis top of mind. Of course, you must. Top of mind. I don't even know where that expression came from, but boy, everybody likes to beat that one to death. So this article goes on. It's about 5 pages of why we should be scared to death of increasing heat. The United States.
But Doug, they left out an important part.
And what's that?
It's a dry heat.
It is a dry heat. That's right. And all Arizonans are taught to say that when they apply for their Arizona driver's license. It's a dry heat. We have to repeat after them a couple of times. So, yep, you're absolutely right. It is a dry heat. So that helps the perspiration do its job of cooling a human being. Here's another article. As record heat sweeps the U.S., some people must choose between food and energy bills. Oh boy, oh boy, oh boy. I would say choose the food, but maybe if we had an administration that didn't screw up the economy, the choice wouldn't be necessary because inflation would not be increasing the cost of everything, including food and energy bills. I think what we're seeing here is suffering caused by very poor management of the U.S. economy. And I could read this whole thing too, but I frankly don't see that it's going to have any benefit. Now, let me get to our last article in this series of warnings, dire warnings. Cold weather raises heart attack risk. Holy crap. So
What
which is
the
it?
heck? What the heck? First of all, it's too frickin' hot.
Yeah.
And now they're freezing us to death and we're having heart attacks. Why can't we just get down the middle of the road?
Well, I finally figured it out, Randy. They got to have something to scream about in the wintertime. And what better time to start in September? This article is entitled September 2, and they're headed towards the argument that the cooling earth is going to kill us all if we make our lives miserable. And I'm sure they'll have a whole bunch of burdens to add to us to pay for the people who don't seem to be employed or able to take care of themselves. But this is an added burden on the heart, may bring higher risks for heart attack during a winter cold spell. This was true for folks with a first-time heart attack and those who had a prior heart attack. Cold temperatures may be more hazardous for the heart than heat waves. Well, which is it? I just read 3 or 4 articles that said that heat was going to kill us, and now it's saying that cold temperatures, well, how convenient that winter is coming our way. So frankly,
I'll tell you what's going to kill us.
what's that?
Idiot politicians. That's what's going to kill us.
And how about idiot reporters and article writers?
Well, there
They're
is
not far
that
behind.
part. There is that part too.
They're not far behind. Maybe we should delve into a subject that's a little more refreshing. Uh, how about Alzheimer's disease? How likely are you to get Alzheimer's if your parent has it? Now, this is a subject.
What'd you say, Doug?
Yeah, there you go. Let me repeat it 4 or 5 times. It might sink in. Alzheimer's disease is a type of dementia that causes problems, memory problems, and cognitive decline. It causes problems, memory problems. I think the author forgot that he wrote the word problems. So it causes problems and cognitive decline. It's a concern for many. Those who've seen their parents or grandparents suffer from the condition may be particularly concerned. Unsurprisingly, one of the many frequently asked questions regards the heredity of this disease. If your parent had Alzheimer's disease, does that mean you're destined to have it too? So the next subject in the article is the role of genetics in Alzheimer's. The influence of genetics on the development of Alzheimer's disease is significant but not absolute. Some genetic variants can lead to a stronger of developing Alzheimer's before age 65 and sometimes even earlier. However, good news, 99 out of 100 cases of Alzheimer's disease are not directly inherited. Research also indicates that individuals who have a parent or sibling with Alzheimer's are much more likely to develop the disease than those who do not have a first-degree relative with Alzheimer's. So those two things would seem to be in conflict. Let's go back to The good news is 99 out of 100 cases of Alzheimer's disease are not directly inherited. And then the next sentence says research also indicates that individuals who have a parent or sibling with Alzheimer's disease are more likely to develop the disease than those who do not. In fact, people who have a first degree relative with Alzheimer's may be 4 to 10 times more likely to develop the disease themselves. Geez, those two things seem to really conflict with each other. Risk factor for Alzheimer's. In some cases where a parent diagnosis, there's a 50% of developing the disease. But again, more than 99% of Alzheimer's cases are not inherited. So even if a grandparent or parent has the disease, it doesn't guarantee that you're going to get it. Age is another significant risk factor. Age increases the risk of developing. So Randy's thoroughly confused by this, and I wish I had a big old whiteboard. I would take a marker and draw what I think the whole thing means. But it's basically saying that there are other factors that cause one to get Alzheimer's. Here's a list of those: head injuries, heart disease, diabetes, strokes, high blood pressure, high cholesterol, smoking, excessive drinking, and depression. Those are all apparently other triggers for Alzheimer's. Geez, anybody who hasn't done one of these things? So the bottom line, despite these statistics, it's important to remember they represent potential risk factors rather than definitive outcomes. Fortunately, research continues in the field and other forms of dementia, including Alzheimer's, with the hope of better understanding of the disease's causes and finding effective treatments. Overall, healthy aging may decrease your risk for developing Alzheimer's. So remember to drink a lot of water. What does that do? Eat a healthy diet, exercise regularly, and stay socially active. And remember, genetics are just one piece of the puzzle. Having a parent with Alzheimer's does not necessarily mean that you will have it also. Well, that's got to be good news for a lot of people. Oh, and here's some bad news for a lot of people. Under new Medicare rules, 3.6 million Americans could be covered for Wegovy. New Medicare rules. The cost of the federal program would be immense, a researcher says. New Medicare rules could make 3.6 million Americans, or even more, eligible for treatment with the pricey weight loss drug Wegovy, a new study finds. Under the new rules, the government will pay for Wegovy treatment if a person with high body mass index also has heart disease. Until now, federal regulations have restricted Medicare from covering drugs prescribed solely for weight loss. For this study, researchers analyzed data from people 65 and older who took part in a federal health and nutrition survey between 2011 and 2020. Maximum annual cost to Medicare could be as high as $34 billion per year if Wegovy is prescribed to all patients with high body index and a history of heart attack, stroke, hardened arteries, or chest pain, the data shows.
I was going to
Wegovy
ask you
has,
what I was going to ask you there, Doug, what Wegovy? I thought it was some sort of a dread disease.
well, it kind of looks like if you watch those commercials where all these tubby people are dancing around in the middle of the street, I would say that's a disease that I don't want to have. But if one is prescribed Wegovy, it has a list price of $1,350 for a 28-day supply. Even if heart disease is more narrowly defined by federal regulators, covering Wegovy, it's a semaglutide, looks to be a budget buster for the Medicare program. Under a narrow definition of heart disease, only 1 in 7 Medicare beneficiaries with elevated BMI, that's body mass index, are likely to be eligible to receive a semaglutide, but cost to Medicare could still exceed $10 billion per year. The findings were published August 26th in the Annals of Internal Medicine. In this conservative coverage scenario, that means most beneficiaries with elevated body mass index and cardiovascular risk would remain ineligible for semaglutide drugs, yet the medication could still potentially become one of the costliest drugs to Medicare. Wow. I hate it when the budget looks like it's going to get busted. It makes me want to go off and have a Guinness. Randy, why don't we go off and have a Guinness somewhere?
That sounds like one wonderful idea. I do have a little bit of a response to the old BMI problem?
Yes, sir.
Quit eating so much.
Ah, there you go. Exercise by pushing away from the table.
That's right. A good friend of mine, who her father was a doctor, he had a wonderful solution to overweight.
And what was that?
Well, he used to say, pick the smallest person in the family, take their plate of food, give it to the person that's having problem with the old BMI, and let them trade. And pretty soon, you know what?
You're
The
going to have
guy with
the
the guy with the BMI problem is beginning to not have such a large problem.
okay. Well, what about that poor small person that's has to eat a huge, giant portion of food?
Well,
What happens to
there's
them?
that. Yeah, there's that. And guess what? It doesn't cost $1,300 a month to do that.
Yeah, I think overall that's a good solution to the problem. I never saw a bunch of fat people when I was a kid. We were out in the woods all the time, running around in Wayne, Illinois, riding our bikes from one house to another and playing various games and burning up energy until, basically until it got dark. And I don't recall, there were only a couple of tubby kids in grade school. And I would venture to guess that that was a representative minority of everybody, like 30 kids that I knew that went to school with me, maybe two or three that were on the tubby side.
Yeah. Well, Margaret and I have spent a bit of time in Europe, and
Yep.
you just do not see people in Europe with that problem.
They've got some kind of a different diet, I would imagine.
Yeah, they don't stuff their face full of stuff like we do.
Well, I have to say that I've porked up a little bit in the last couple of years because helping people with Medicare is not physically demanding. And I really need to get back to more active, more physically demanding activities like restoring old cars and things like
You know
that.
what I was going to say? You get home, you know what we could do, Doug?
What's that?
We could put that blower on your vet that I keep asking about.
Something, I like the idea in theory, but the problem is when we take a saw out to cut a hole in the hood of the Corvette, the spousal unit is going to come after both of us,
With a saw, right?
probably with the saw if she can wrestle it away from us.
Well, you know something, I really, someday we're going to talk, maybe we can have two different hoods.
Ah, there you go. That wouldn't be a bad idea. We can swap them out as the need arises for us to drive around with that blower sticking out of that
Yes.
Corvette.
You could have one of those, lift mechanisms from the roof of your garage that can pull up the blower and then you can put it back down when you need it.
I think it'd be easier to change the hood, don't you?
Well, yeah, we could do that too.
Oh no, the blower would be in the way. That's right.
Yeah,
The
the
blower would
blower
be in
would,
the way.
yeah, that would be the problem. The blower would still be on the top of the engine. Well, anyway,
Well,
when you get home, we will consider additional solutions to that problem. But in the
okay.
meantime, we need to go ahead and sign off. But before we do, make a pencil notation of DBJ at MLMmailbag.com. That's how where you can reach out to Doug any time of the day or night. He monitors that email box regularly. Number one on my list, don't forget he is licensed nationwide to help you with your Medicare supplement planning. Check us out at the website, medicareforthelazyman.com. We would also appreciate it if you drop a review for our content. Doug works at it really hard, and we're coming into the end of the year, and we need those numbers. Last but certainly not least, thank you for joining us. You could have been anywhere doing anything, and you weren't. You were with us, which is exactly where we like to have you, listening to Medicare for the Lazy Man podcast. But as I always have to warn you, keep track of the time on your wristwatch, because if you don't, I have to let you know. You have spent about 32 and a half minutes with Doug Jones, the anti-insurance insurance guy from Oklahoma. No more. He spends most of his time in the high ground behind Cave Creek, Arizona, actually in the low atmosphere. There's no oxygen up there. I don't know how he does it. But bottom line, right now, he's storing up oxygen down in the low ground out there in Illinois. So maybe that's how he does it. Maybe he just stores it up, and then when he's out here, he uses what he stored when he was in Illinois.
Yeah, that's the ticket. That's the ticket. Well, thanks a lot for joining us, ladies and gentlemen. Come on back for our next episode. We'll be waiting for you with the lights on and the doors open. Bye bye.